Today I'll be talking about ultrasound-guided hematoma blocks for sternal fractures, a case series report. I have no financial conflicts of interest to disclose. So sternal fractures are very common injuries occurring in 8 to 10% of motor vehicle collisions. These fractures are notoriously painful. And so fracture pain can result in splinting, which can lead to hypoventilation, and this can lead to pulmonary morbidity, which can be exacerbated by pain control using high doses of opioids. So point-of-care ultrasound is a quick and effective way that is already used to diagnose sternal fractures at the bedside. So once point-of-care ultrasound is used, a point-of-care ultrasound-guided fracture hematoma block, or FHB, is a technique that can be employed and can provide analgesia. So the talk today will consist of two parts. First, I'll go through the procedural technique for performing a hematoma block, and then I'll give a case series of 3 fracture hematoma blocks using ultrasound technique. So first, in terms of the procedural technique, the patient needs to be laid in a supine position and prepped and draped in a sterile fashion. Prior to performing the hematoma block, it's important to inject some local anesthetic with a small needle into the subcutaneous tissues. This can be done in the supine position as well. After the local anesthesia is obtained in the subcutaneous tissues, the ultrasound can be used to visualize both the hematoma, as shown here, the fracture, and then a spinal needle is inserted. Typically, a 20-gauge needle can be used. This can be visualized under ultrasound, and anesthesia is achieved using approximately 20 cc's of 0.5 to 1% bupivacaine, which can be injected right adjacent to the hematoma. Here's a video showing this. So the needle is entered, and approximately 20 cc's of anesthetic are injected into the subcutaneous tissue. You can see that ideally most of the anesthetic is injected right near the fracture site. So in terms of our study design, we did a case series where we retrospectively identified 3 cases of point-of-care ultrasound diagnosed sternal fractures who presented to our large tertiary center emergency department, and these were after motor vehicle collisions. All patients had significant sternal pain, and the fractures were confirmed both with ultrasound and with CT. All subjects in the study had a fracture hematoma block performed with a 20-gauge spinal needle, and 20 cc's of 1% bupivacaine were injected under direct visualization as described previously. And we looked at pain scales, vital signs, and the use of analgesics, particularly opioids. And so our hypothesis for this study is that this technique reduces pain scores and reduces the need for opioid analgesia. So amongst the 3 patients we looked at, they were ages 68, 74, and 78. They all had isolated sternal fractures with no other injuries. Before performing a sternal hematoma block, their pain scales were 6 out of 10, 5 out of 10, and 4 out of 10. Afterwards, the pain scales were reduced respectively to 0 out of 10, 4 out of 10, and 3 out of 10. And so this is shown here graphically, and this represents an average pain score of 5 out of 10 before the block and then reduced to 3.5 out of 10. So an average reduction of minus 1.5 in pain scores. Notably, the patient that received the most reduction in pain scores, so from 6 out of 10 to 0 out of 10, was performed by a very experienced provider, while the other 2 were performed by a somewhat less experienced provider who had not performed sternal hematoma blocks previously. And importantly, only 1 out of the 3 patients required any additional opioid analgesia during their ED stay after the hematoma block was performed. So in summary, we presented a small case series showing that a fracture hematoma block reduced all pain scales in all 3 subjects we looked at. We saw that fracture hematoma blocks decreased the need for additional opioids during the observation period in the ED. We did see, however, that our results were operator dependent. And so we propose this as a somewhat novel technique and an effective means of obtaining pain control. But of course, further studies need to be performed, such as randomized control trials and prospective studies.